Most people believe a stroke is something loud, dramatic, and impossible to miss. A sudden fall, slurred speech, a face that can't smile anymore. But what if I told you that many strokes happen quietly, without pain, without warning, and without the classic signs you've been taught to look for? In the United States, stroke is one of the leading causes of death and long-term disability. Every year, hundreds of thousands of Americans experience a stroke, and many of them never realize what truly happened until months or even years later. Here's the uncomfortable truth: not all strokes announce themselves. Some don't cause immediate paralysis. Some don't affect speech right away. Some feel like nothing more than a bad day, unusual fatigue, or a strange moment of confusion. These are called silent strokes, and they are far more common than most people imagine. They quietly damage brain tissue, steal memory, affect balance, mood, and cognition, and dramatically increase the risk of dementia and major strokes later in life. Today, you're going to learn the 8 warning signs of a silent stroke that should never be ignored. Signs that are often dismissed, misinterpreted, or dangerously normalized. Because when it comes to the brain, time is not just life, time is who you are. Before we talk about silent strokes, you need to understand how a stroke actually happens. About 85% of all strokes are ischemic, meaning they occur when a blood vessel supplying the brain becomes blocked. This blockage prevents oxygen and nutrients from reaching brain cells, and without oxygen, brain tissue begins to die within minutes. The severity of symptoms depends on 2 main factors: where the blockage occurs and how large the affected vessel is. When a large artery is blocked, symptoms are usually dramatic and obvious. But when smaller vessels are affected, especially deep inside the brain, the damage can happen quietly. That's why silent strokes are so dangerous. They don't always cause immediate weakness or speech problems. Instead, they create small areas of brain injury that often go unnoticed, but the damage is real and permanent. And here's something most people don't realize: multiple small strokes over time are a major cause of vascular dementia. Waiting to see if symptoms go away is one of the most dangerous mistakes someone can make. When it comes to stroke, every minute matters, even when symptoms seem mild or confusing. If the brain is being deprived of blood, waiting is never harmless. That's why recognizing subtle signs early can literally preserve memory, independence, and quality of life. One of the most important things to understand about strokes, silent or not, is how suddenly they begin. A stroke doesn't slowly build over days. It doesn't politely warn you in advance. Most stroke symptoms appear out of nowhere. A person may feel completely fine, and then within seconds or minutes, something changes. That sudden onset is one of the biggest red flags. Any symptom that appears abruptly, especially neurological symptoms, should always be taken seriously. Sudden confusion, unexpected fatigue, dizziness, vision changes, or unusual sensations are never normal when they come on quickly. Many people make the mistake of comparing these symptoms to low blood sugar, dehydration, stress, or anxiety. And while those conditions can cause discomfort, they usually don't start instantly. Silent strokes often hide behind subtle, confusing sensations, but the timing gives them away. If something changes suddenly, your brain may be telling you it's not getting the blood it needs. And here's why speed matters. Even symptoms that seem mild at first can rapidly evolve into a larger stroke, causing permanent disability. Recognizing the moment when something suddenly feels off can make the difference between full recovery and lifelong consequences. Most people are familiar with the classic stroke symptoms, the ones shown in public awareness campaigns. Sudden weakness on one side of the body, a drooping face, slurred or difficult speech, loss of vision, severe headache. When these signs appear, the danger is usually obvious. But here's the problem: only a minority of strokes present this way. In many cases, especially with silent strokes, none of these classic symptoms show up. Instead, the brain is injured in areas responsible for balance, memory, mood, coordination, or awareness, functions that don't always trigger alarm bells. That's why relying only on the classic checklist can be misleading. Silent strokes don't follow the rules people expect. They don't always affect movement. They don't always affect speech. And they don't always cause pain. Yet the damage they leave behind can quietly reshape a person's life, affecting concentration, decision-making, emotional control, and long-term independence. Understanding that absence of dramatic symptoms does not mean absence of danger is a critical shift in awareness. Because when a stroke whispers instead of shouts, it's easier to ignore and far more dangerous to miss. Let's talk now about the first silent warning sign that often goes unnoticed: sudden, unusual sleepiness. This isn't normal tiredness. It doesn't build gradually throughout the day. And it doesn't improve with rest, caffeine, or fresh air. Sleepiness related to a silent stroke often appears abruptly and without explanation. A person may feel overwhelmingly drowsy, struggle to stay awake during conversations, or even fall asleep unexpectedly. What makes this especially dangerous is how easily it's dismissed. People blame poor sleep, stress, medications, or exhaustion. But stroke-related sleepiness feels different. Heavier, more intense, and impossible to fight. In some cases, the person can barely keep their eyes open, even when something important is happening around them. This type of sudden drowsiness can signal that parts of the brain responsible for alertness are being deprived of oxygen. When extreme sleepiness appears out of nowhere, it's not a moment to sleep it off. It's a moment to seek medical attention. Because the brain doesn't recover lost oxygen with rest, it needs blood flow restored. Another silent warning sign that often confuses people is sudden nausea or vomiting. When nausea is related to a silent stroke, it doesn't behave like a stomach bug or food poisoning. There is usually no abdominal pain, no diarrhea, and no clear digestive trigger. Instead, the nausea appears suddenly and is often accompanied by dizziness or vertigo, the sensation that the room is spinning or tilting. This happens because certain areas of the brain control balance and spatial orientation. When blood flow to these regions is disrupted, the body reacts with nausea, instability, and a strong urge to vomit. Many people assume it's dehydration, a viral illness, or something they ate. So they stay home, lie down, and wait. But when nausea and vomiting appear abruptly, especially alongside dizziness, imbalance, or visual disturbance, the cause may not be in the stomach at all. It may be coming from the brain. Ignoring these signs can allow the stroke to progress, increasing the risk of more extensive brain damage. Sudden nausea without a clear explanation is never something to casually dismiss. In some cases, a silent stroke doesn't show up as weakness or confusion at all. It appears as a seizure. This surprises many people. If an adult who has never been diagnosed with epilepsy suddenly experiences a seizure without an obvious cause, A stroke must be considered as a possible explanation. Stroke-related seizures can involve full-body convulsions, loss of consciousness, or sudden, uncontrolled movements. They happen because injured brain tissue becomes electrically unstable. What makes this especially concerning is that people often focus only on the seizure itself, without asking why it happened. A first-time seizure in adulthood is never normal. It's a medical emergency. In some cases, the seizure is the only visible sign that a silent stroke has occurred. Without imaging, the brain injury may go undetected. That's why immediate hospital evaluation is essential, not hours later, not the next day. When seizures appear without a clear history or explanation, the brain is signaling that something serious has gone wrong. And silence, in this situation, is never reassurance. Another warning sign that almost no one associates with stroke is persistent hiccups. Occasional hiccups are harmless. They come and go. But when hiccups last for hours or even days, without a clear cause, they can signal something much more serious. Certain areas of the brainstem help regulate breathing and involuntary movements like hiccups. When blood flow to these regions is disrupted, the result can be hiccups that simply won't stop. What makes this symptom dangerous is how easily it's ignored. People laugh it off, search for home remedies, or assume it's irritation in the stomach. But persistent hiccups become especially concerning when they appear alongside numbness, dizziness, difficulty coordinating movements, or changes in sensation. In these cases, hiccups are not the problem, they're a clue. They may be one of the only outward signs that a silent stroke is affecting deep structures of the brain. When something as simple as hiccups refuses to stop and feels different than usual, it's worth asking a serious question. Could this be coming from the brain? Pain is not the symptom most people associate with stroke, but in rare and often confusing cases, pain can be the warning sign. A silent stroke may cause sudden pain in the face, in one arm or leg, or on one entire side of the body. The pain can feel sharp, burning, or deep, and it may come and go or persist without a clear reason. Because there's no visible injury, people often assume it's muscular, dental, or nerve-related. But when pain appears suddenly and doesn't match a typical pattern, the source may be neurological. Strokes can also cause severe headaches, especially when pressure inside the skull increases. Some people experience neck stiffness or difficulty moving the head comfortably. What's important to understand is that stroke-related pain often acts as a warning, appearing before more disabling symptoms like weakness or loss of coordination. When unexplained pain shows up abruptly, especially alongside other subtle changes, it shouldn't be ignored. Pain doesn't always mean injury to muscles or joints. Sometimes, it means the brain is in trouble. Another silent and easily overlooked sign is fainting, also known as syncope. Fainting related to a silent stroke can be especially confusing because it often resembles other conditions, such as dehydration, low blood pressure, or heart rhythm issues. The person may suddenly feel weak, lightheaded, or disconnected, and then lose consciousness for a brief moment. What makes stroke-related syncope dangerous is that it may be the only visible symptom. Once the person regains consciousness, they may feel mostly normal, leading everyone to assume the episode wasn't serious. But when fainting happens without a clear explanation, especially in people with risk factors like high blood pressure, diabetes, high cholesterol, or heart disease, it should never be ignored. In some cases, the fainting episode reflects a temporary disruption of blood flow to critical brain areas. The brain cannot tolerate even short interruptions without consequence. If fainting appears suddenly and doesn't have an obvious cause, Immediate medical evaluation is essential, because sometimes what looks like a brief blackout is actually the brain warning that something much bigger is happening. One of the most underestimated signs of a silent stroke is sudden changes in memory or orientation. This doesn't always look dramatic. It may start as brief moments of confusion, forgetting where you are, losing track of time, struggling to remember something that should be familiar. In some cases, memory lapses are the only symptom of a silent stroke. A person may repeat questions, feel mentally foggy, or have trouble forming new memories, a condition known as anterograde amnesia. What makes this especially dangerous is how often it's attributed to stress, aging, or lack of sleep. But when memory problems appear suddenly, they are not a normal part of getting older. Brain imaging frequently reveals that people with unexplained memory decline have suffered multiple small strokes in the past, many of which went unnoticed at the time. Each silent stroke leaves behind damage, and over time, that damage accumulates. Recognizing the first memory-related warning sign could prevent a cascade of future strokes and preserve cognitive independence for years to come. There is one final silent sign that ties all the others together: sudden changes in behavior, mood, or personality. Some people experience anxiety out of nowhere. Others become unusually irritable, apathetic, or emotionally flat. In rare cases, a silent stroke may even trigger symptoms that resemble depression, bipolar disorder, or psychosis. When these changes appear suddenly, especially in adults with no psychiatric history, they should raise concern. The brain areas that regulate emotion and judgment are just as vulnerable to silent strokes as those that control movement or speech. Now take a moment and reflect. Have you, or someone close to you, experienced any of these signs and brushed them off as stress, age, or nothing serious? If this video made you think of someone, share it with them. Awareness saves lives. Leave a comment below and tell us which symptoms stood out to you the most. Your voice matters here. And if you're not subscribed yet, subscribe now. This channel is dedicated to helping you recognize the signals your body sends before it's too late. Because the most dangerous warnings are often the quiet ones.